Thank you so much, everyone. My name is Musa Umar. I am a radiotherapist at National Hospital Abuja, and I also specialize in public health. I'm the founder of Call of Cancer Initiative and the convener of Arewa Cancer Control Coalition here in Nigeria. I am the FCT coordinator for Youth Coalition Against Cancer, the youth arm of the Nigerian Cancer Society. I'm a cancer advocate, an advocate of non-communicable diseases and also youth health. I am so happy to be here today. Thank you so much for inviting me, Mr. Usman, and well done for this amazing event that you've put together. How does quality and specialized medical treatment impact the choice of patients? We all know that the foremost thing in the minds of patients is being healthy. When they seek healthcare, we have the issues of access to care, we have the issues of non-specialized healthcare, but there are a lot of options available. What impacts the choice of patients when they seek healthcare? As a radiotherapist myself, I treat cancer and I see how patients grapple with the idea of navigation and the idea of where to go to seek health, and being lost in the thoughts of where is the best place for them to go. As an advocate, through my foundation, most times I get one of the things that we offer is navigation for patients, especially cancer patients. Where do I go? Which doctor should I see? I need radiotherapy. We know that that is a very popular word when we're talking about inequities and lack of access to care. We know we will always need more and more radiotherapy machines to treat patients, for example. And even when it comes to preventive care, which we advocate for, especially in specialties like oncology. When a woman needs, for example, to go for a mammogram, and then she calls the foundation and says, I live in the Northeast, I would like to do a breast scan or a breast imaging, I would like to go for a pap smear for cervical cancer, and she doesn't know where to go. And as a healthcare provider or as a tourism expert, you have the knowledge to guide patients on where to go depending on what they seek in healthcare. And it's not just health. We all know that patients can go to hospitals and it's not just for them to get consultations, medications. There's much more to what patients need. The standardized services, competence, how they are being treated as vulnerable part of the population, because we know that once a person is sick, their sense of judgment is no longer the same, and they get vulnerable, and that is when as healthcare providers or organizations giving healthcare services, empathy comes in, considerations come in, friendliness comes in, politeness comes in. So there's a whole lot more that patients need other than just healthcare. And also not putting them in more danger than they already are. Yes, because the healthcare providers here can agree with me that sometimes a healthy patient can go to the hospital for something entirely different and then gets infected with something else, adding to their problems. So we also have to thrive to see that we are not adding to their problems too. For example, we know what nosocomial infection is. A patient can come to the hospital just while queuing to see their patient, they sit beside a patient that has maybe tuberculosis or something like that, and then they maybe contract if care is not taken. That is also the responsibility of that healthcare organization. So I want to greet you all again, distinguished guests, colleagues, and partners in health. It is my honor to welcome you all to this important session at the 3rd All Africa Medical and Wellness Expo. Our discussion today centers on how quality and specialized medical treatment impact the choice of patients. We know that across Africa and the world, patients are becoming more informed, and they are now empowered to make decisions about where, when, and how they access care. Quality of treatment, availability of specialized services, trust in their healthcare provider, very important. Affordability, especially in the context of lack of universal health coverage in low and middle income countries like here in Nigeria. And also cultural perceptions all influence these choices. Today, we are privileged to hear from a distinguished panel of leaders whose expertise spans hospital management, medical tourism, specialized care, and patient navigation. Together, we will explore how we can ensure that patients in Africa and also beyond Africa are not only given choices, but also the right quality of choices to live healthier lives. So I'll just sit with my panelists and we will begin the discussions. Thank you.
Bang!
Okay, so I understand that Dr. Mohammed Al-Dar is not with us. So we have Mr. Solomon, Dr. Solomon Yakubu. Yes. Khalid, yes. So we have Dr. Khalid El-Nouri, and we have Ambassador Tina Kelechuku. Please, can I have someone give me a pen, please? I need to make a little adjustments on the panelists. Thank you. Okay, so I'm going to start with you, Dr. Khalid El-Nouri, CEO of Shafa El Orman Hospital Group, Egypt. You're welcome, sir. Egypt has positioned itself as a hub for medical treatment in Africa and in the Middle East too. What lessons can other African countries learn from Egypt in building centers of excellence that attract patients' trust? Because that is very important. To you, sir.
Good morning, ladies and gentlemen. It's an honor to be here and to be on the panelist. To start answering this question, I would like to emphasize the fact that before talking about Egypt, I would like to give a hint about what is the concept of quality in healthcare. When we talk about quality, originally quality was defined as doing right things right first time and every time. Doing this, we have to put some sort of policies and procedures and standards to follow up on a regular basis. By time, I would say that this definition have been changed a little bit. When we talk about this, we talk about continuous improvement. Because if we don't improve, we will not move forward. As I always say, that quality, if you don't continuously improve, we will stay in a plateau phase. And if you stay in a plateau phase for some time, actually by time you will go down. When we talk about continuous improvement, we have to focus on three main issues. Number one, patient safety. When we talk about patient safety, we are talking about how to provide this service in a safe manner without jeopardizing the patient life and putting him in a position that he may suffer from side effects or complications. Patient safety is very important, but it is not enough. I can provide good patient safety service, but without considering the patient himself. So in addition to the patient safety, we would like to say that patient satisfaction is a milestone which is very important to fulfill the patient needs. Finally, these are from two main issues from the patient perspective, but for the quality of service to be continuous and sustainable, we have to consider the fact that this should be done in an efficient manner. When we talk about efficiency, we are talking about how to provide the best quality and patient safety service with patient satisfaction with the minimal resources utilized. I think this is the main issue of patient safety and quality of care for patients. This is for.
Thank you so much. A round of applause to Dr. Khalid El Nouri. Let's give him a round of applause, please. Thank you so much, Dr. Khalid El Nouri, and I agree with you that quality of care is really very important. Safety is also equally important. And I would like to move to Ambassador Tina. From your experience, Ma, you know, patients often weigh quality against cost. From your experience, how can African health systems strike a balance between affordability and high-quality specialized care?
All right, so thank you so very much, Dr. Uma, and thank you, everyone. All right, so the honest truth about it is that the both of them need to actually be balanced. You know, affordability and also quality. It is very, very important. Now, we can't say because we're looking for lesser costs, want a better cost, and then we'll go for low standard. At the end of the day, you know, the aim and everything is defeated. So the goal is that how do we balance the both? You know, we're getting the quality, we're getting the standard, and at the same time, you know, the cost is also to the barest minimum. Now, the first of all, what I would suggest is collaboration. That's number one. So we look for possible collaborations and partnerships because the honest truth about it is that we have people who have already done that and then they're doing well. So first of all, just like we discussed yesterday, you learn what are they doing, how are we going to do it to make it better, and all of that. And sometimes when there are also collaboration, you realize that at the end of the day, you are still able to partner, you know, with your partnership. These things are you get them at an affordable rate. I give an example for the equipment and all of that. You know that maybe getting them within the country might be a little bit expensive, or maybe sourcing them within might be a little bit expensive. So what do you need to do? You look for people who manufacture those things and see how you can collaborate and then get them in affordable rate. And of course, when equipment are also gotten in a very affordable rate, what happens? Because these are things that also lead to costing and all of that. And then again, it's also important that we look at regulation of costs, because you realize that I think one of the things that we haven't gotten right is that somebody can open up a business today and then you put in an amount. I give an example in the hospitals here in Nigeria. You can't specifically say this is the cost of this. If you go to a certain environment, it's a different cost. You go to a certain environment, it's a different cost. You go to another place, it's a different cost. I mean, the cost of doing this particular lab test here, especially in this Abuja, just because you are in Maitama, the cost of that is already like triple. Just because you are in certain area, the cost is already. So there should also be a kind of standard that try to also regulate all of these things, because no matter how profitable we want to make our business look like, patient care and affordability is also very, very important. I give an example. There's an hospital in Abuja here that I've worked with. If you enter the hospital, they have like about 5 different rates. Once you come in and they see your ID card, or I work in an embassy, they will go to your rate is rate D. Once they get to that rate D, something that is probably 1,000 automatically is 5,000, and that is how the system is already projected. And then if you walk in and you say you are so, they give you another rate. So these things are not checkmated, and at the end of the day, people are being ripped, and then all in the name that if you don't pay high, you won't get quality health care. So I think that there's something needs to also be done in that particular area, of course, regulation and all of that. It is so that people get things, in affordable rate, and then at the same time, the quality is also there. So I think I'm going to, because of our time, these two for now. Thank you.
Thank you so much, Ambassador Tina. And I mean, I agree with you. I think it's very important to have some regulations. Hello? Okay, so I think it's very important to have some regulation, especially around costing, because that is a major issue in this part of the country. And another thing is the first thing you mentioned, collaborations and partnerships. The saying that they say, alone you can go fast, but together you can go far. In my experience as an advocate with my foundation, a lot of things that I see, and I think that it is far-fetched for me, especially as an upcoming NGO. But with collaborations, we have achieved more than we thought we could. I think no matter how big an organization is, collaboration is really very important. So I'd head over to Dr. Solomon Yakubu, sir. So I'd like to ask you, sir, you know, medical tourism is growing rapidly, and patients travel for quality. That's the truth of the matter. They travel for quality. What trends are you observing in patients' decision making, and what role do you think quality assurance play in this trend?
Thank you very much for that question. It's striking questions. Yes, let's start this way. Yesterday, we were talking about cost, trying to say, compare the cost that treatment go for in Nigeria to do that of abroad. We're trying to see that is Nigeria is literally cheaper than going there, because we add other things, cost of a hotel, transportation, and what have you. Now, my stand on that is that what really impacts the choice of a patient is not is a quality and specialized treatment. Quality and specialized treatment, because quality and specialized treatment build trust and reputation. And everybody like a place that you go and then you have trust and confidence in that place. So when it has to do with a trust, reputation is not a thing to compromise with. People prefer to go to where they can actually trust. And that has to do with what? Quality. It has to do with a specialized care. You know, when somebody has a quality, it encompasses care, the way you you attend to your patients, the way you administer treatments to them. For example, there was a time my wife was not feeling fine, and we needed to go to hospital. We went to a medical center. And the way they, you know, for a long time, we were waiting for them to attend to us, and the sickness was so severe. So they had not attended to us. We were on the waiting list for a long time. And I saw that this thing was deteriorating. So I have to make my choice immediately to another place. And immediately we moved to another place. As we came there, they attended to us very fast, and I was satisfied. So satisfaction. Next time you ask me to go to select between the first place I went and another place, I will go to the last place they attended to me. Satisfaction. It has to do with the care. It has to do with the way you know, it's patient-centered. Not all about the money you can get or the way. And if you treat people anyhow, that reputation is not there. So reputation and trust make people to select their choice. So my advice is that apart from having hospital here and there, let's cultivate the habit of what? You know, administering care. We care for our patients. Let our treatment, let our concern be patient-centered. If we know that patients, we are treating patients and they are the center, and we have concern for them, and everything we do is about, we care about their quality care, you discover that it becomes a place they always want to go again and again. So reputation and trust. People actually want to trust a system. I want to trust a system, it becomes their choice. Thank you.
Thank you so much. Please, a round of applause to Dr. Solomon Yakubu. Well done and well said, sir. So I would like to go back to Dr. Khalid El-Nouri, sir. How do you think hospital leadership and governance contribute to patient confidence in choosing specialized care?
Definitely, the governance is very critical in controlling the hospitals. And if you say that the top management actually and the governing team, if they are committed to quality of care, then all the hospital staff will be in the same track. When we talk about governance, actually it is one of the most important factors that controls the quality of the hospitals. For example, in our institution, we have a governing body who is following up all the activities of the hospital on a weekly basis to see what's going on, what is on the track, what is out the track, and they are the follow-up is very important from the governing body. Also, there is, the governing body is responsible for setting the code of behavior and code of activities in the hospitals. And if they put it all right from the beginning, then it will probably, because the top management, if the top management is not involved in this process, then nobody will be keen to follow up the rules and the regulations of the hospital. Thank you.
Thank you so much, Dr. Khalid. And I totally agree, because I understand that leadership and in management of healthcare is really very important. Being the boss is not just about being the one that gets greeted by everyone when you walk in. It comes with a lot of responsibilities, because a leader, especially in a healthcare setting, can actually influence the performance of each and every employee, can actually influence the mindset of that employee, which ultimately results in their performance. This is very, very important. So I would like to go back to Ambassador Tina Ma. If the Minister of Health and Social Welfare would be listening now, what advice do you think you would give for the healthcare sector in Nigeria to be a hub for medical tourism, not just in Africa, but in the whole world globally, from your experience?
All right, thank you so much for that question. All right, so if I'm to have the Minister of Health, Nigeria here, just like we extensively discussed yesterday, one of it is we noticed that in Nigeria, there's no regulated medical tourism, policies. So we have to start from there. And then, of course, it's not just saying we have to start from there. This is the third edition of the All Africa Medical and Wellness Expo, right? So what it means that we've had the first, we've had the second, and this is the third. So, and they had to start with us making a move, making a step. So it doesn't just end us gathering here and then in this panel talking about it. What are the steps we're taking? What are the concept notes that we're coming up? What are the communiques that are coming out of this to say that these are our suggestions, these are the policies that we're suggesting to see that there's regulation, the policies backing up medical tourism in Nigeria. So I think before we get to the ministers or maybe the honorable members on our health and all of that, let us also from here take a step, and then we'll be able to put it on their table. So policy is actually very, very important. And then again, yesterday after I left here, I was just revisiting everything that happened yesterday, and I realized there was something very important. Somebody actually mentioned it. When we talk about medical tourism, it's something that looks as if it's for the elite and all of that. We forgot that there are people in the villages, there are people in the rural areas. These people as well also need medical tourism. So what happens to them if they need to move from point A to point B? If they need to move from point A to point B, or they need to travel out and all of that, so do they actually have what it takes? So what is the primary health care system also doing to ensure that people are not dying in the rural areas like chicken just because they cannot afford even ordinary transportation to convey them from the rural area to the urban area? So I think even the primary health care system is also very important in this equation. They are not left out, because when we talk about medical tourism, people think is that just go to the airport and then you jet out of the country. Now, even before you jet out of the country, somebody have to move from point A to point B, right? And then before you now make plans of how you are going to, travel and all of that. And then, of course, like we also discussed again, HMOs also on this equation, they are in the middle, referring and all of that. How are they doing this thing to make sure that things are well facilitated on all of that? And of course, even embassies, we said it, next time that we have program like this, what do we need to do? We need to get the embassies on board, because we can't talk about, strengthening this medical tourism if these people are not involved. Because at the end of the day, no matter how the hospital you are traveling to or where you are going to, especially if you're traveling out of Nigeria, they've given you invitation and all of that, and then you can't get a visa to travel. There's nothing you can do about it. There's nothing you can do about it. So these are things that we feel that is important. And of course, enabling environment. Enabling environment is also very key. When we're talking about medical tourism, a lot of people are saying, okay, reverse it. We cannot do medical tourism and all of that. The honest truth about it is that we have what it takes. And of course, collaboration at government level. I mean, I was speaking to one of the participants yesterday. She told me how she came into the country and then with beautiful ideas on how she made a contact. She's a nurse that practiced outside the country for over 15 years, and she came into Nigeria. She had these beautiful ideas where she has established some relationship, and then she wrote to the Nigerian government telling them that, oh, I've practiced outside the country for like 15 years and I have this established contact. Nigeria as a nation can actually partner with this, and let's see how they can actually get equipment and then sign a partnership that hospitals can be equipped and all of that. She said while she was following up behind, somebody hijacked the project, and then at the end of the day, that didn't see the light of the day. What are we also doing to ensure that things like this are not swept under carpet? When people come up with beautiful ideas like this, let us look at it. Let's sit down with them and then look at it and see how this can actually be achieved. So I'll stop here. Thank you.
Please, a round of applause, Ambassador Tina. Well said. I mean, I couldn't agree more that I think we have, especially our upcoming healthcare specialists and people working around healthcare, they have excellent ideas. But yes, there's no enabling environment. I can tell as an advocate that a lot of people come up with the idea and then they are lacking trust. Who do I present this idea to? Because you don't know who picks up your idea and just go and revamp it a little bit and launch it somewhere. And it ends up failing because they don't have the passion that you have when you develop those ideas. So I think it's very important. And secondly, I would like to also emphasize, yes, what you said about primary healthcare centers being the foundation of healthcare in every community, in every country, in every nation. And as a member of Technical Working Group for the Federal Ministry of Health, Technical Working Group for Youth Health, and Ministry of Youth Development, and also I'm a member of National Task Force for Cervical Cancer Elimination. And I was surprised actually, because it was my first time being part of policy making when it comes to advocacy. All the work centers around primary healthcare. It centers around, building it from the ground up. We can't just go taking care of the top when the foundation is failing. So I think this is really on point, and this should be noted. It should be a part of the communique at the end of this program. I understand that Dr. Mrs. Charity Azunna Akpambo is with us, founder of Ishuri Travels and Global Concepts Limited, Nigeria. Please, ma'am, can you come up to the stage? A round of applause to her, please. You're welcome. Let me just bombard you with your own question once you're seated. Welcome, ma'am. Dr. Mrs. Charity Azunna Akpambo, you're welcome to our panel discussion on how quality and specialized medical treatment impact the choice of patients. Ma, I would like to ask you, I know you're still catching your breath, from your work in patient facilitation and sustainable initiatives, what challenges do Nigerian patients face when seeking specialized treatment locally or abroad? Because they are the center of all this discussion. The patient is the center of this discussion. So what do you think are the challenges that they face while seeking specialized healthcare?
Thank you very much for your question. And I just finished catching my breath. Okay, I'm going to be speaking from the patient perspective. For patient, there is a lot of challenges because one, for a patient to go to a hospital, they need to probably have trust and confidence that they are going to get good service delivery, and they are going to also get quality health care. And also, they also want a situation where the recovery process will also be, fast. So those are major challenges for them. So how do we now go about this? How do you know that this hospital have the specialties that you need, to get the special treatment that you're seeking for? So I think in the part of the hospital, we have to do more on promoting our healthcare and the services that we provide. Because if you don't promote this, if it is not rated, if your reviews are not out there, people will not be able to access some of these informations. So in Nigeria especially, we have very good hospitals and very good medical health cares. But when you go to the internet to do a search for a particular healthcare service, how many of them are you going to see there? So if you don't have people that will do the word of mouth referral to say, okay, I've been to this hospital and they have very good doctors and their healthcare is perfect, you may start having issues. So if we talk about those in the rural areas, for instance, now, when someone is sick and you have a chronic kind of illness, not just the normal, where you need that specialized healthcare. How do you get access to the information? How do you know the hospitals that you go to? So I think that's where we need to, work and ensure that that gap, of information is actually bridged. And now everybody is actually exposed to social media, and online platforms, because that is the in thing now. That's where you get most of the information. So hospitals should try to update their websites. There are websites, a lot of hospitals have websites, but when you go there, you don't see anything actually. So you have to promote yourself for people to know what you're doing, for people to have that confidence, for people to build trust in you. So mostly what we do is you start acting like when my dad was sick some years ago, I had to start calling the doctors that I know. Okay, please, my dad is sick. This is what he's passing through. What do you think? Which hospital do you think we go to? So some of them recommended some hospitals where we went to. And another thing, there's an issue of getting the treatment, or getting to even see a doctor. You go to some of the specialist hospitals we have. Let me talk about Nigeria. The first hospital we went to, which was in Abuja here, we got there like in October. And after doing all the initial test and everything, they asked us to come back in March. That's the point. That was appointment that we got now was March next year. Wow. So you mean we should just go home and die? That's that was what I just thought. I was like, I don't understand. Is this really happening? You're giving us October to March to come and see a doctor. That means you just don't want to treat a patient. So when you see such things, you get disappointed. So when we now from that hospital to another private hospital, they asked us, okay, after going through the same, routine and all that, they now said they have to recommend, a specialized doctor for this treatment. And this is the amount that we have to pay. Immediately we paid that money. This same doctor came from the hospital that we left. In 30 minutes, they asked us if you can wait. In 30 minutes, she was there with us to attend to the same problem that we came to a government hospital to treat. So what do we say? It's not everybody that have funds for private hospitals. If you go to the government hospitals, you get the same quality treatment, the same quality doctors. But why do you have to take so long to see a doctor? Yes, before you get treatment and things like that. So I think those are some of the gaps, and the challenges that patients face in getting medical treatment.
A round of applause, please, to Dr. Charity Azuna. I think we all agree with her that it is, I think the worst thing that could happen to a healthcare system is when the patients have no access to the healthcare provider. I know when a patient is sick and then you tell them to come back 6 months later, it is just unfair. On every level, it's not fair. And I see this, I'm a healthcare practitioner too, and I see how patients with terminal illnesses like cancer, I treat cancer, and I see how they don't have options. They get lost at the hospital because they don't have options. If the option given to them is what they cannot afford, invariably they don't have any option because there's no option in their own standard that they can have access to. And I think that with lack of universal health coverage, I don't understand what the patient should be dealing with. Is it the lack of health, or is it the financial toxicity, lack of access? Most times they even pay and then there's no access. And I think that's where we mentioned the JAPA syndrome. Because why are doctors scarce in a country that, what is the minimum number of doctors that we graduate every year? Last year I was at the NYSC camp, and I saw the number of graduates there. I saw the number of graduates that went to medical school, and I was like, patients still stay at home because their appointment is like 2-3 months after. It is so unfair, and there's a need for robust system checks to put these things back in place.
All right,
so I'll come back to you.
Sorry, I want to just just add, yes. I think another thing that we also need to look at also in the area of early diagnosis as well, because I don't know if I can say it's the problem of equipment, or is a problem of professionalism, or is a problem of inpatients. I really don't know where to classify it, because sometimes okay, I'll give an example of someone I know that has a 10-year-old son, and then all of a sudden started losing weight and all of that, and it was really very drastic. Before you know, it started going in from one hospital to another hospital, one hospital to another hospital. And they kept on treating malaria, typhoid, malaria, typhoid, malaria, typhoid. Kept on running liver, kidney. I mean, it's just looking like anywhere you go to, the next thing is malaria, typhoid, kidney function, this one and the other one. And it took like almost a year and 2 years to now finally realize that it was something that had to do with hyperthyroidism or something like that, and all of that. And it was a very long time. Now the question was, why is it? I mean, this is something you are a professional. There are already like markers, there's things you should look out for and all of that when you notice this thing. Why are diagnoses taking so much time in Nigeria? I mean, I can't understand. Is it that people are not patient enough to properly, look down and check very well? Sometimes you go in there and then they're in a haze, onto the next, and all of that. And people kept on wasting money upon money. Before diagnoses come out, you've spent even the money that you would have used for treatment. Or is it that the equipment are not there? I really cannot tell. So I think this diagnosis something is very important. I also have a close family friend that, this issue with ulcer and all of that people will say ulcer, any small thing in the tummy, ulcer, and then they are not going to go and check. This was how this woman was saying ulcer. Before you know it, it took a very long time before they realized that it was a colon cancer. My God. They kept on going. Each hospital they go, they give her something for ulcer. They go here, give her something for ulcer. And then it took like over a year before they finally realized that it was colon cancer. Now imagine if those things were diagnosed on time. The day they finally, even in Nigeria, finally realized it was colon cancer, and she needed them to be diffused. That same day they got to the hospital was going on strike. That same day, and she needed like about 2 pints or 3 pints. So what are you supposed to do? They said there's nothing they can do. The hospital is not working, they are going on strike and all of that. For somebody that needed to be transfused, at that point they have to look for another location, try to do what they need to do, and then eventually they travel to India. By the time they got to India, the question, it was the husband that was sharing this with me directly. He said the question, after they finished all the check and everything, the first question they asked them was, why was this thing not diagnosed early in Nigeria? That her case was something that if it was noticed on time, they would have just done some adjustment, and then he said, in fact, according to the word of the husband, he said there are no doctors in Nigeria that could have detected this thing earlier. So ladies and gentlemen, this woman eventually came to Nigeria after everything, and eventually she passed on. And then till today, that trauma is still living with the family. So I think there's something we need to do, and this is the reason why this program has been put together. And I'm sure the Amwe took time to give invitation to a lot of hospitals. This is an opportunity for you to collaborate, for you to have, is the equipment, what do you need to do? But you can never find them in this kind of meeting. And then at the end of the day, this thing keep happening and keep happening. We'll gather, we keep talking and keep talking. But people that need to hear, people that need to implement, we are naira a day. And then to all of us that are here, please take as much as you can, and then let's see what we need to start doing in our own little corner. Thank you.
The rate, also the costs, reduce costs and accessibility. You know that you'll be able to get the best doctors to treat you because you can actually afford it, and because maybe the government or some private institutions are in partnership with you and they will help you in some cost as well. And also another thing we'll talk about is that partnership will also bring about the quality, high quality of medical services, because the service is not just about the doctors. After the doctors, how about the post-medical care? You know, will you have access to those? You can go for surgery. A lot of people die not just from the surgeries and the medical care, but because after the whole process, there's no proper follow-up. You know, when they have emergencies in their homes, they don't know what to do. Before they get to the hospital, they are already dead. So this partnership will help cut a lot of cost, a lot of loss, you know, of lives, because people will now trust the system more. People will have more confidence to work, and also people loyalty. You know, when they talk about good doctors and good hospitals, and you go to such place and you also get the best kind of treatment, you'll be loyal to that hospital. So it will build people's loyalty as well, and people confident in the health system, whether it's in Nigeria or outside.
Oh, yes, you're absolutely right. Thank you.
Yeah, just to add, partnership can also lead to profitability. That's also very important, because the honest truth about it is that people set in hospitals and all of that, in as much as patient care is in the center, quality is in the center. But sometimes we need to also understand that it's business. That's the honest truth about it. And every business is set for profitability, and that is it. So the honest truth about it is that when you go for partnership collaboration, in fact, I tell people that partnership collaboration is the future of every successful business. So if you are there and you are still on your corner doing things small, you need to rise up to the occasion. That's the honest truth about it, because it will expand your reach and all of that, and then more inflows coming from different angles, and you make more money. And when you make more money, you also have opportunity to engage in corporate social responsibility. You give back to society, you can support advocacy, you can support campaigns, you can do other things. But when you are struggling at the corner where you are not even able to pay your staff, and then they are telling you about advocacy and all of that, you won't be able to do that. So partnership is key, not just only patient-centered, but with the other things that we need to also do, you know, to assist the society as well. When you partner, it opens you up more profitability, more business, and you can also have little to also support, assist the government. Yes, there's some things you can do that will bring a relief to government, because you have been able to expand your scope and all of that. So partnership is the way to go. Thank you.
Wow, yeah. Please, a round of applause to our panelists. Thank you so much. I mean, the energy here is palpable, and the passion, we could talk all day about this. We are all passionate about what we're saying. Thank you very much to our esteemed panelists for sharing such deep insights and practical perspectives. What we have learned today is clear. Patients will always seek quality and trust, whether in their home country or abroad. It is our responsibility as stakeholders to ensure that specialized care is accessible, it's affordable, and also reliable. Not just for a privileged few, but every individual who walks into a health facility, because no one is immune to sickness. As we conclude, let us remember that behind every decision patients make about treatment lies a story of hope, a story of survival, and a story of trust in the system. May our collective efforts continue to shape healthcare systems that give patients not just choices, but the right choices that lead to healthier futures. Thank you so much to everyone here, and thank you for your kind attention. Can we have a picture? Yeah.